allow me to invite Rotarian Liz to introduce the speaker for today.
Thank you, Madam President. I hope I'm audible enough.
Yes, please proceed.
Thank you. Good evening, our friends and family of Rotary. All protocol observed. Allow me to introduce our speaker for this evening, Mr. Richard Mwangi, who is a consultant in audiology. Mr. Richard Mwangi is a lead consultant at Doctors of Hearing, Kenya and Incas Hearing and ENT Center. Mr. Richard Mwangi holds a master's degree in clinical audiology and hearing therapy from a prestigious international university of Isabel y de Castilla, that's in Spain. He has been in audiology and hearing healthcare for the last 15 years. Richard started in pharmaceutical industry, but later changed his career on realization of shortage hearing healthcare services in Kenya. Richard is an accomplished consultant in audiology who runs a chain of hearing healthcare centers in Nairobi, as well as satellite audiology centers all over Kenya. Richard Mwangi is a correspondent in American Journal of Otolaryngology and the Head and Neck Surgery and Global Journal of Otolaryngology, where he has authored several articles of hearing healthcare. Richard has been accredited in South Africa. His accreditation number is STA 007-3605-2012 and Spain Certificate of Registration FV 2019-156353. And he is a fellow of British Academy of Audiology, FBAA. Richard is an award-winning audiologist, having been awarded a top 40 under 40 influential men category in the year 2015. He has been a facilitator and a trainer on usage of clinical auditory brainstream response ABR at Mnazi Mmoja Hospital in Zanzibar, where the hospital launched a newborn hearing screening unit. Richard has been involved in various corporate social responsibility projects, such as yearly donation of hearing aids to needy cases, most recent being Mr. Julius Wanyonda Gitonga, the Kenyan super centenarian who many believed was the world's oldest person, who died this year at the age of 137 years. May his soul continue resting in peace. And Master Abdul Malik Isaac, the top Isiolo Boys High School 2020 top KCC student with hearing impairments. He scored 8 B plane of 66 points. Apart from clinical work, Richard is an associate lecturer at the Medical College in Nairobi, Department of Audiology and Hearing Healthcare. Richard is married with 4 kids, loves sightseeing, reading and occasional golfing. Richard is a car enthusiast and his drink of choice is a cold beer. So friends and family of Rotary, help me welcome Richard Mwangi this evening to speak to us. Thank you. Welcome, Richard.
Good evening, Rotarians, family and friends of Rotary. As a good introduction has been done, my name is Richard Mwangi, and basically what you're going to learn today is, or just the talk that you have tonight is, just what you're going to discuss tonight is the science of hearing, human hearing, and balance in regards to diagnosis, treatment, and management. Now you'll help me to share the screen because it's disabled.
It's now good.
Thank you. I'm going to share a short video on how the ear works.
Is the video playing from your end?
Yes, it's playing. Is it not playing on your side?
No, it's showing the files you are opening.
Okay, let's see.
You could open the video before sharing and then share after it has started playing.
Okay, let's see. Better still, we can still go straight to the discussion. Can you see my screen now?
Yes, the files.
Yes, the PowerPoint.
PowerPoint, not yet. If you could share, if you could share after you have opened it. I think it's sharing only what you pick, but not when you move to a new page, it doesn't move. It's not moving.
Okay.
There, yeah, it's there.
There you
now.
have it now? Okay,
Yes.
good. So our practice is audiovestibular medicine, the science of human hearing and balance. This is in diagnosis, treatment, and management. Now, we want to describe what exactly it is audiovestibular medicine. And we say that the core role of audiovestibular physician, now this is people who practice the audiovestibular medicine, that is in the hearing and balance, is to diagnose, investigate, and management of hearing and balance disorders. You'll find that typical patients will present with various signs. That include the hearing loss, tinnitus, that is ringing sound that happens. Some people describe it is happening on top of their head. Others will be specific, it is right or left. And it presents itself in different tones. Some people argue it is more like ocean-like sound. Others will argue like it is cricket. Others will say it is a fan. Others will say it's like, it's rain. That kind of sound is what we call tinnitus. And also other patients will present with dizziness, imbalance, eye movement disorders, and speech problem. Now, we have our ears and we want to know how the normal ear functions, because the sound transmits through the ear, sound waves. Now the sound waves are gathered by the outer ear and sent to the ear canal, to the eardrum. And all that sound is, to the eardrum, then makes the eardrum to vibrate, which sets the three tiny bones in the middle ear into motion. In the picture below, you'll see how, all the sound moves. You see the structures of the ears, and this will make sense in the next slide. So the motion of the three bones causes the fluid in the inner ear or in the cochlea. The cochlea is, if you remember very well in our biology, is a snail-shaped organ to move. And then the movements of the fluid in the ear, in the inner ear, is a hair source, the cochlea that beds, and then the movement the sound is changed into electrical impulse. That impulse is the one that you find it is understood as a sound and makes the speech more understandable. Now, what you find from outside, or what is visibly seen, is that it's outer ear, the parts that we see from outside, the part that's called the outer ear, called the pinna, and that helps in channeling the sound and also increasing the volume. Then you find there's a part that's also called the ear canal, where you find that it has got few layers with fine hair. This is where you find the wax accumulates. And it's at this point that I'll say that the wax is good in the ear, and nobody should interrupt the movement of or should involve themselves in cleaning the wax, because it is not supposed to be cleaned. The ear canal, or what we call the auditory canal, has got more of what we say, the skin is more of a conveyor belt. It pushes out the wax by itself. And when you're showering, that's the time you find that you put a bathing towel just within the ear canal and find it comes up dirty. What will happen in the market is that you'll see earbuds, or what we call Q-tips, being sold there. What you don't read is that there's small writing disclaimer saying they should not be put inside the ear canal. And then as you find that more injuries are happening by perforation of the eardrum, and it becomes a very costly and traumatic experience. Now, the middle ear is the one that you get next after the ear canal. Then after the ear canal, there's a 3 tiny bones. The slide is coming for that, which it's called malleus, incus, and stapes. All that we'll see, because they help in conducting the sound as part of the hearing, for human hearing. Any interruption of these 3 parts you've talked, outer ear, middle ear, and the ossicular chain, will cause a hearing impairment, be it an infection, be it wax impacted in the ear canal that need to be cleaned by a specialist. That will cause an impairment. Then also you find that there's an eustachian tube. These are tubes that most of us, we find that we would want to pop, maybe taking a flight or driving in a road that changes in matters of altitude. You find that the pressure builds up. Or when you're having a flu, you feel like you want to, build pressure in your ear by closing your mouth and closing your nose so that you can pop it. And also by yawning, by chewing, and also by swallowing, you feel kind of a pop. That's the eustachian tube. The inner ear is where we get the final sound to be sent to the brain. So the sound moves from the outer ear, middle ear, and the inner ear. There's also the structure called semicircular canals. These are canals that helps in maintaining balance. So that brings our topic to be in audiovestibular medicine. The cochlea is the organ that we've talked of being the last to amplify the sound we take in the brain. Now, this is the outer ear. You can see my cursor. Can you see it?
Yes.
Okay, good.
Yes.
Okay, good. This is the outer ear we are talking about. All these, this is the ear canal. Wax happens to be here, okay? You can all see that?
Yes.
This is where the wax happens. And sometimes it can be, almost half, covering the half of the ear canal. Sometimes you can see this is bent. In actual sense, in physiology and anatomy of the ear, this is slightly, it comes down further than this one. So it makes sense that the wax, when it's built up, it will slide off and come to this point. And this is the point that, when you're showering, put a bathing towel, you find the wax, it's almost here. Any interruption of this part, let's say you use the Q-tips or the earbuds that are found in the market, you push this further and it starts building up at this point here. Once it builds, this place here doesn't produce wax as such. So it builds up here. And that's the time you find people will have unexplainable itchiness that happens. They don't know how the itchiness is good when they're putting the Q-tips, but it's not supposed to be there. Normally that itchiness is a description of the fungus infection. So this movement of the wax should not be interrupted at all. Now, this is the eardrum here. When you push wax, especially in most cases when you're using the Q-tips, it comes to a point that it builds up and then you start, affecting the vibrations of the eardrum. Because in normal circumstances, this eardrum vibrates. Even now as we talk, listening to me carefully and you're listening very well, your hearing is very good, this is vibrating. And when it vibrates, it transmits the sound here. Now we talked of the 3 bones inside the ear. So this is the one that we call the malleus. When we are looking to patient ear, that this part you can see it because this is more of a translucent kind of a membrane. So be careful when you understand the anatomy and physiology of this part, you'll see what you call the malleus handle here. So this one, the bone, this is the second one, and this is the third one. I'm sure this one you can all remember sometimes in high school, we're taught over 3 tiny bones inside the ear. Now, and this is the cochlea. In the ear is responsible for two things: for the hearing, where the cochlea is involved, and for the balance, where you find the semicircular canal. Now, these two work hand in hand in sometimes controlling the human balance, because a condition that can affect this and affect this one will also end up interrupting your balance. Now, this is the auditory nerve, or what you call the nerve, auditory nerve, or what you call cochlear nerve, and this is vestibular nerve, or what you call the balance nerve. All these one adding to the brain for interpretation of the stimuli or the signal that is sent. Also, we talked about the station tube, the tube that you would want to pop sometime after flying or taking off, or when you're driving on, the road that has got a little bit bumpy and the change of altitude. This is what you find that you would want to pop sometime. So what you do is that you build up the pressure by by blocking your nose, and also by closing your mouth, and then you just get up, just breathe within you. Then you find that this pops sometime. Now, we've talked about the hearing impairment, and then according to World Health Organization, is that a person who is not able to hear, let's see this one here. A person who is not able to hear, as well as someone with normal hearing, threshold of about 20. I'll explain what that means. All better in both ears is said to have hearing loss. And this hearing loss presents itself in different manner. Some people have got mild hearing loss, others got moderate, others have got moderately severe and severe, and this the profound. The profound is worst case scenario, and you find that the person who's got profound hearing impairment is those we classify as being deaf. Now, hearing can affect one or both ears, and to investigate which side is affected or the severity of one side, comparing with the other, we do a number of tests, but the most important test is audiometry. The audiometry is a test that will just get us the threshold of how the person is hearing and at what level and at what frequency. It will also give us a classification of whether it's more of an age-related hearing loss, whether it's interruption of the eardrum part, whether it's interruption of the middle ear part, whether the person is impacted with what. After even looking at in the ear, you'll find that you can find the ear is clear, but there's something we call otitis media infection. This is an infection that is beyond the eardrum. If I can go back here and try to tell you what that means, is that if you look into this, we use the otoscope or video otoscope to project the eardrum to the screen so that the doctor and the patient can study together. So this part here can get infection, what we call otitis media effusion, or what has been commonly known as glue ear, especially in the in pediatric. So this one you cannot see by the look through here. It also affects the hearing. So by doing the audiometry test, you'll find that we'll get so many classification of the hearing impairment, or what we're causing this person not to hear very well. Now, in my previous slide, I've talked about hearing impairment. Now, when you're doing this test, is that we want to plot a graph. Okay, we plot a graph according to the way the patient is responding. So basically, how this test is conducted is that it's a soundproof room. The patient is you feed the patient with some headphones, right and the left, and then you start presenting what you call pure tone sounds. So for normal cases, you find the graph is plotted within this part. Now, if it's not within this part, we start classifying the hearing impairment from mild to a profound case. So we test the loudness against the frequency, and that's how we plot the graph. So you may find that some people have got mild hearing loss, moderate, severe, or even profound. And this time you'll be able to give diagnosis of what exactly is the level of the impairment of this patient. Now, some of the signs, one thing I would like to say is that hearing impairment is one of the hidden disability. So if somebody comes to you and just sits there, don't talk, say nothing, do not understand whether they hear or not, because it's so hidden, and to understand whether they are hearing or not, you have to get a conversation. You have to get into a conversation with them so that at least you can be aware whether this person is hearing. And in most cases, you'll find that people who've got hearing impairment, especially the old people, they'll try to speak loudly. This is the reason, is that we hear ourselves when we talk. And that's why we can confidently be able to tell that we are whispering, we are shouting. But somebody who has got hearing impairment, they'll not be able to hear themselves fast. So they'll tend to talk loud, or even, shout for the conversation to go on. Now, some of the signs that you'll find that people complain of muffled speech, and they find that there are other sounds. Other sounds is that when you have got a hearing disturbance, or what we call a hearing impairment, is that these people tend to hear too much of background noise. For a normal hearing person, naturally, the ear knows how to cancel out the background noises. But for somebody who's got a hearing impairment, you find that they'll complain of muffled speech. Or they say, you tend to speak to yourself, and we can hardly understand what you're saying. Because even them, they don't understand whether the hearing impairment is there. Because one, hearing impairment, you'll not find that it's pain, there's no inflammation, there's no this thing of emergency that will make you run to the hospital for you to be attended to. It happens as a very gradual process. And that's why we find that some of the patients will not be able to understand themselves that they've got hearing impairment. Now, we've talked about difficult understanding words. You see, some of this, depending on the degree of the hearing impairment, patients will not be able to understand the words, but they'll hear, you talk, but they cannot understand. As happens in the background noises, let's talk about restaurant or the crowded places. You'll also find something we call speech discrimination. Now, that will be explained by trouble hearing the consonant. I'm sure most of us have heard of people saying, this person is getting more of a heavy tongue as he continues. It's not of a heavy tongue. You investigated very well, you find that there's a little bit of a degree of hearing impairment that is happening to this person. And then you find that instead of this person saying the word like school, SCH will miss, and it'll be replaced by something called cool, something like TS. So they miss the consonant part of it. And then, of course, you'll find them, frequently asking others to speak more slowly, clearly, and loudly. Now, this point, you understand it more better now that we are wearing mask. The speech is muffled for everyone because we are wearing the face mask. And you'll find that so many people have relied on what we call lip reading. See, hearing impairment is not that you are deaf. You can hear, but sometimes it's challenging to understand what the person is talking, what the person is saying. So you find that people tend to ask you, speak slowly, clearly, and loudly. Reason being that they want to understand. They want you word by word. You let yourself be clear and loud more than how you speak to other people. Then speech lip reading is not happening anymore because we're interacting ourselves with mask. So you find that lately we are getting so many of clientele saying, I think either I don't hear very well, or the mask, they're making the speech difficult. I can't hear people talking to me very well. It's because, in life, some adjustments just happens without you knowing. Like when you have person has got maybe mild, moderate impairment, and you can still see people talking to you. You understand the language, you can hear a bit, and then you can make out the speech, or you can make out the conversation that is happening. You'll also find out that they need to turn up the volume over television, over radio, very high. So if you're seated, or you maybe see you're coming out from, from work, and there's a hearing impaired person that is not known to you, you'll find that the volume of a TV, it's extremely loud, or the radio they're playing the music very loudly, and you cannot be able to handle it. So these are the signs and symptoms that some of these people will present themselves with. You'll also find themselves withdrawing from conversation. They withdraw from the conversation because you might ask them a question and they respond, in a quite of a different way. In my practice for about 15 years is that I've listened to patient stories, and the most interesting one is one that I had an old lady telling me that in one of their chamas, so to say, is that she was asked to contribute for a point. Now, because she has always been the person asked to lead others in prayers, instead of contributing to what the other were talking about, she ended up, leading people in prayers, and it was all embarrassment. So the next thing she did is that it's a withdrawal from conversation, because you don't want that kind of embarrassment to happen again. And then set up by avoiding the social setting. So you'll find that so much so that the hearing impairment is not, you cannot tell the person has got hearing impairment, or what you say is that hidden disability. The person experiencing hearing impairment end up suffering more than you may think. Now, there are causes of hearing loss, or what we call a hearing impairment. And some of these things are congenital. You may find that this problem is genetic also, and includes, either the parent or the mother, had rubella, or during the birth, there was low oxygen at birth, or the severe jaundice in neonatal period, that is, the few days that the baby is born and before this discharge, or let's say the 2 weeks of after birth. And also some other things that will cause this thing is that low birth weight. And this will bring a topic of, the developmental problem of the fetus. Maybe you find that because of the low birth weight, some structures of the ear never developed very well. Or they developed, but they never developed fully. Then you find that there's disturbance or the hearing impairment into that. Also, you'll find that there's in childhood, there's chronic ear infections, and also meningitis, mumps. Sorry for I missed that M, and other infections. Now, the chronic ear infections, you must have seen, children with pus coming out from the ear. Now, if left untreated, will end up causing some hearing problem at a later age. I also find that another cause is in adulthood and old age is chronic diseases, diabetics, high blood pressure. It's another condition we call autosclerosis. Autosclerosis is the, you remember the 3 bones we talked about? When it happens that there's a growth, an abnormal growth within those 3 bones we talked about, then causing them fixation. That fixation interrupts the normal way the sound is supposed to happen. And that's what we call autosclerosis. And also there's something called age-related generation, and also sudden hearing loss. Now, age-related sensory neural hearing loss is what we call, presbycusis. And also you find it, some years back, it was starting from about 60. Now it is more about 55. Some people experience this in their, early 50s. You may find that they have got hearing impairment because of the change of, the chronic diseases coming, early in life, the lifestyle we live, the use of headphones, the stereo phones that we put inside the ear. We normally advise is that if you want to listen to the music, maybe while you're working, or some people listen to some sound when they are studying, use the traditional headphones, because they'll let out the sound pressure and not to cause more of a, intense pressure to the eardrum, because sound is energy. Or we talk in the physics, I'm sure you can remember that sound is energy and what we call mechanical energy. So if it's let to accumulate too much into the ear canal, it will push eardrum, and then the eardrum pushes the ossicular chain, the three bones, and then all these add up to the cochlea, which causes noise-induced hearing impairment. That's the point of saying this hearing impairment, or what we call age-related hearing impairment, it's happening a little bit earlier nowadays because of the exposure of some of the things we happen in our lives. Now, also, these factors are, across the lifespan. Impacted work, that is, can be cleaned and removed, that is temporary. Trauma to the ear or to the head, during accident, or just being hit by, accidentally being hit. Loud noise we've talked about. Ototoxic medicine is medicine that harms the hearing. Now, the medicine like quinine, high doses of aspirin, gentamicin, and also some cancer medication that can cause hearing impairment. Also, you see, in the case that somebody want to start a tuberculosis regime treatment, they'll have to be sent for hearing impairment, because some of the medication used can also end up causing the hearing impairment, and they belong to the class of ototoxic medication. These viral infections and more other ear conditions that can cause the hearing impairment. So of the loud noise you've talked about, these people also found, you find the occupational, let's say the police, the military men and women, also people working in the mining industry. Those noises can cause damage to their hearing. Also recreation noises. There's some people use, of hunting, firearms, people in airport, services, jet engines, all those areas that have got loud noises, people in Juakali sector, and also maybe nowadays, because we know how our matatus are, we can see also there's too much of noise pollution, and that can also be traumatic to the hearing. And we say that they can also be recreation noises, because some people would want to feel the oomph of the music, and they end up harming their hearing. Sense. Now, as I talked earlier, that the hearing impairment, it's a very gradual process. Yes, we have some sudden cases, and those sudden cases, they should be treated as emergency as they are, because there must be something else that is causing that kind of sudden impairment. But 90% of hearing impairment, they are gradual. So you may find like people in Juakali sector, they say we are used to this kind of noise. People in construction, now that there's construction happening all around, the street of Nairobi, they're using compressors, and you find that they don't have any protective gear for their ears. It is harming. It is a gradual process, and it will eventually harm the hearing levels. We also talked about some illnesses which may result to high fever, such as meningitis, mumps, and may damage also the cochlea, which is the hearing organ. Now, if left unattended, hearing impairment will cause so much trouble in children, in adults, and each and every person who's having the hearing impairment will end up having an issue. Now, when we talk about children and how to assess hearing, somebody might ask, how do we know that the child is not hearing and not tested? In the last, for a couple of years, I think about 20 years, there's something called newborn hearing screening. So when the mother delivers in the hospital, most hospital will offer hearing screening. Yes, I understand very few are offering in this country, but I mean, it's coming soon, and it should be able to be done. Why it has to be done is to see whether this child is good to go. Hearing is okay, and the child is able to hear the sound, come to the age of development, the sound, this child will be able to develop the speech with the age of the peers. Now, some other children may find that they have got a hearing problem, but not detected. And then it's time to go to school, and you find that they cannot compete with their peers. And that's why, we find that this gentleman from Isiolo was born with a hearing impairment. And with all the difficulties he passed his KCSE. And also, what, made us to be part of his life and give him some hearing aids for free, and so that he can continue with his education. Now he's just enrolled to DISTA. He's doing a good course there, and unfortunately will be a good person in society. So in education, there's the children with hearing impairment and deafness often don't receive schooling. And you find that most people, what they think of next is to take them to special schools. It's not that any person with a hearing impairment, it's not that every child with a hearing impairment to be taken to special school. Because as you have seen before, is different degrees of hearing impairment. You said of mild, it can be moderate, it can be moderately severe, or even profound. Now, when the child is diagnosed with hearing impairment, there's so many tests to do, to know whether the child has got hearing impairment, and we run them in our centers to know whether the child has got a hearing impairment or not. Or this happens concern of a parent, or concern of a teacher, or the relatives that finds that the child is big enough and they should be knowing their name, they should know their mom name, they should know a few things. So it is through that we get, patients who are children to be assessed. Or you find that the children who got delayed milestone. Now, after assessing and find the degree, there's always some help when they are young enough. And that's why the point that I say, the hearing test should be done at early age, when there is a suspicion of hearing impairment. Be it maybe the mother had some complication, high, what you call, high blood pressure that develops during the pregnancy, the preeclampsia. So that child need to be taken to be assessed. What we normally do here is that we'll ask, after delivery, is that the child cried, yes. What is the color of the skin? It was this and this. Those questions, what we call upper gas score, and it is, I think, 1 out of 5, if I remember very well. So this hearing impairment, this hearing test should be included in that. Sight should also be included in that, so that when the mother leaves the hospital, they are able to know that their child is of good health, there's nothing to interrupt, the development, everything is okay. Now that's about the children. Now, there's a hearing impairment also, if left undressed for adults, we find that they have got complications at getting employment. Now, maybe you are the human resource person here, and this person comes to you, all the grades, because these people, even if they don't hear very well, they go through the normal schooling, they read a lot. That's how they are gifted. They know that, yes, I may not get all what is being taught in class, but with the help of the books and the notes from our friends, I can get it. Now they pass the exam, but let's come to the employment part. They have all their papers in order. They come to you and you ask them a question. You might first find that this person is ignorant or being rude, because you'll ask the question and the person doesn't respond. It is not that they are rude, it's because they don't hear. And this person will lose that job, because you, as the interviewer, you'll find that this person got an attitude, or cannot be able to follow what exactly is asked, or, he's just being there, he's arrogant, all those manner of negative things you'll be able to conclude. But little do you know that this person cannot be able to hear. Now, so we also talk about the social isolation. You may find that the person don't want to engage as much. Say, I no longer go to meet, my friends. I don't know, go to parties. I don't know, go to my chamas. I don't know, go to meetings. I don't go to church functions nowadays. I just want to stay by myself. And also, that's the time also we feel that the person can also be lonely, because, the way human beings we are made to be social. We are made to be in a social status of interaction with other human beings, and that's how life should be. You'll also find that they end up being stigmatized. And you find that for a study that has been done, people feel like there's a feeling of altered self-perception. that this person used to be able and now is disabled. And that also brings out some other complications in life. You find that this person, apart from the hearing impairment, about being stigmatized, apart of being lonely, lack of job, isolation, is that this person starts checking into depression slowly by slowly, because the social interaction part of it, it's not happening. This person is also stigmatized and lonely and end up being, a depressed person. Now, on identification is that we say that early identification of the hearing impairment is talked about newborn and infants. These newborns and infants is something called prelingual hearing impairment, that they happen to have hearing impairment before the development of the language. So that's we say prelingual. And the only way you can know that they have got hearing impairment is by testing. Preschool and school age children, they also people should be, they are always checked. I've seen quite a number of schools asking for, especially when the child is going to think previous rules. No, grade 2, grade 3, because at that point they understand the sound. Some schools, they have been asking for hearing screening for their learners, so that they can know, here we don't have a problem with the hearing impairment. They'll be more suspicious of if the child is not performing very well, if child tend to be, quote unquote rude. Okay, not being rude is that they cannot be able to hear, so they are not responding to the answers they are being asked. So those are the cases that you find that they are sending to us to assess and to make some notes about their hearing level. Also, people who has been exposed to the noise or chemicals. We've worked with the Kenya Defence Forces in matters of hearing assessment, and you find that quite a number of people or the soldiers, they have been affected by the noise of their tool of trade, which is the gun, and that's the time you find that they have got hearing impairment. So we say that people who are exposed to the noise and chemicals at work, they also need to be assessed. Also, some of the companies that we've done for hearing screenings, that you find that they are barbed wire companies, we'll mention the name. There's also cement companies that you've done for the hearing screening, and also some shoe manufacturing company that is, they do their work somewhere in Limuru. So we have done quite a number of those ones. The reason being is that they're exposed to too much noise, and the employer will need to study. And also is required by the labor laws to keep the records of your employers, the health records of your employers, and especially matters hearing in those companies or those industries that are manufacturing, noise producing, like the cement companies, quarries, the steel companies, all those industries. And of course, the old people also, they are also at risk because of what we call age-related hearing impairment. And there's a description of world WHO that says 5% of world population, or 43 million people, require rehabilitation to address their disabling hearing loss. Per the adults versus the children, you find that 432 million of adults and 34 million children. Those are the people, the WHO classified 5% of the population. And then the worrying thing is that it is estimated that by 2050, over 700 million people, or 1 in every 10, will be having disabling hearing impairment. And this will increase because of the lifestyle, the noise, the recreation noise that we talked about, also the chronic disease happening at an early age. All those things will contribute to this unfortunate number of about 700 million by 2050. The management of the hearing impairment is done by audiologists, okay? And this, they do it in audiology center. Those are the same people who deal with audiovestibular, because all these things are interrelated and you cannot separate them. Now, on the hearing loss, is that once the hearing loss is identified, it is essential to address it as early as possible. Just like any other, health condition, when noticed early, if hearing loss is detected early, it is better sorted out at that point. But what we find is that with population is that since there's no, one thing we know is that the hearing loss or hearing impairment cannot kill you. So some people are not very fast to look at it as an emergency when it's detected. Others will say, oh, it doesn't hurt, I can still hear, that kind of argument. And they take too long to have this addressed. In fact, I was reading another study saying that you'll find that when a patient is coming to you with hearing impairment case, they'll have lasted for about 5 to 7 years with that situation. So they're coming to you when it's too bad, or when the members of the family, they have complained too much that we cannot hear you. You cannot hear us and you cannot understand us. You're not even participating in conversation. I asked you this one, you didn't answer the other day. Those kind of accusation. That's just because this person didn't address the hearing impairment at early stage. Now, there are measures also available to rehabilitate the hearing impairment. The hearing technology that is available is of hearing aids and the cochlear implants. Also, there is something called middle ear implants. So depending on where the hearing problem is it in the nerve part? Is it in the middle ear? If it's outer ear, which in most cases is maybe foreign body object, somebody has put in something in the ear, or the insect is the ear, that can be cleaned. If it's wax that is impacted, that can be cleaned. Depending on what causing the hearing impairment, depending on what we see as it's causing the hearing impairment of the patient, it is different ways of addressing it. If the wax is cleaned, if there's an insect inside the ear, it's cleaned. Now, if it's nerve damage, it's hearing aids, and also the cochlear implant. If there's damage of the 3 bones that we talked about, is what we call middle ear implant. Depending the case, we say that the hearing impairment cases, they are dealt as they are. So there's no replication of this one has this one, so I might be having the same problem. No, we say one doesn't fit all. So hearing impairment also doesn't fit everyone. There's also rehabilitation therapy, where we talk of speech therapy, and especially when the hearing impairment is happening to the children, and they have been diagnosed, they've been assessed. You want them to develop speech. The rehabilitation therapy is more of giving the speech therapy. Speech therapy is given by speech therapists. These are like teachers who teach hearing impaired kids. Or it can also happen to an adult who has got some traumatic experiencing, and somehow the speech is normal. They need to be taught what speech was, and this is done by speech therapy. They are more like teachers of speech, and they educate on how to learn, to pronounce words correctly. And they can be also, in adults who've got traumatic experience that they have, the speech is gone. They teach them on how to do it once more time. And we've talked of also hearing assistive devices, the frequency modulation. In the airport, you've also seen some loop system. Loop system is where you find that you don't have to sit so close to where the microphone is to be announced that your next flight is happening the next 2 hours or 1 hour. So some airports have installed what we call loop system for the hearing impaired people. And also I think some Airbuses have got loop system so that if you have got hearing impairment, you can be able to follow through your interview. There's also sign language, which is also very important when you have hearing impairment. And then also sign language will be important in cases where you find that the child was born with the hearing impairment, they can talk, and let them learn the sign language is an added advantage to them. So that's all about the hearing impairment. I think I would want to take the dizziness, or you would want to have some questions at that point.
Wow, the dizziness bit is quite funny. I wish to invite Rotary and Joy to take us through the questions. Rotary and Joy.
Good evening, family and friends of Rotary. Can you hear me?
Yes.
Yes, you can.
There is one question from, there are two questions from E. Kimani. The first question is, does the eardrum heal if one experiences injury to the ear resulting in a burst, stroke perforated eardrum? Richard, would you like to take that, or can I read the next one?
Yes, let me just take that. Yes, the eardrum heals when there's, the perforation. But what you find the bigger population do is that some of the things that will happen for the eardrum perforation, some accidents in the house, when you're using a earbud and then the Q-tip, and then you find that somehow you forgot it is in the ear, and you lie on it, and then you perforate your eardrum. Others, there's like sometimes in our practice we find some cases of arise from the domestic issues, and then you find that somebody somewhere was hit from the and the perforation of the eardrum. Those are the cases that can cause. Also, in an accident, also the eardrum can perforate. That would be more of a very traumatic experience. But what you say is that the eardrum heals itself. But what you find people do is that they'll rush to the pharmacy and given some eardrops. Once they're given the eardrops and they put it in the ear, they interfere with the healing process of the membrane. So in any case that you find that something has happened and you cannot hear very well, have it checked. The doctor will ask you, oh, did you go to the hospital? No, I went to the pharmacy and I was given this eardrop. That's bad. You should just leave it like that. Avoid water getting to it. Let it heal by itself. Because when you interrupt with the process of healing, now that will have to end up being in a surgery case that it has to be repaired in a procedure we call tympanoplasty. So that means it is trying to repair it, or just depending on the size, try to scrap it all, and then you have some grafting done, and then the eardrum it's replaced. But in most cases, when this happens, when this tragic experience happen, and maybe the eardrum, maybe somebody has hit somebody there, don't rush the pharmacy and put any eardrop. The pharmacy guys will be generous enough to sell it to you. I'm sure they wouldn't like me to say that. Yeah, but what happens is it interferes with the healing process of the membrane. So let it checked, leave it for the night, leave it for the following day. It cannot go worse than that. Have it checked the following day. Thank you.
Okay, thank you. I'm stuck on something in the ear and then you lie on it. I'm still feeling the pain. Question number 2, what causes vertigo?
That's the next subject you're going about, the dizziness.
Okay, cool. Another question, now the ear sounds from quinine make sense. Does it mean some level of damage is caused after taking quinine, or would this be after long time usage?
About the quinine, some years back, it used to be a first line treatment for the severe cases of malaria. Even today, in some cases, it's better life than death through the malaria. So you find that some doctors will use it because the situation is too bad, and it's better you treat it, and then you treat you have the consequences of having the side effects. Some people get damage of the hearing, the organ of the hearing, which is called the cochlea. Others will not. So you may find that it is severe, it is mild, it is moderate. Others will be completely deaf. This happens within the period of the treatment. It doesn't happen afterwards. So you may find that the patient saying, yes, I was admitted and this was given to me, and the following day I couldn't hear, or all we're seeing is that the doctor was talking to me, or just seeing the lips movement. It happens that fast within that period. For some other medication, like the treatment of the TB, you find it is be a gradual process. But eventually, some people might also be affected, others might not be affected. So I'm not saying that quinine affects everyone. I'm sure quite a number of people have gotten the treatment of quinine, but they're still hearing. So it is not everyone that is affected by the medication. A bigger percentage of people are affected by the medication. Others, they lose their hearing completely. So it is not that it causes to everyone the hearing impairment.
All right. Question number 3, 4, 3. Well, 4. Can use of earphone affect our hearing abilities over time, particularly this time of COVID-19, where we are having online meetings 24/7?
24/7 for a meeting? That means 24 hours, 7 days in a week. No,
I think that one is trying to get out of a meeting with the boss.
What happens in the use of the headphones is that it's what we call 60-60 rule, and that's where the time comes in. Use the volume at 60. If you're the person, the guys of call center, that's what we advise them, because they're always having their headphones on. Use 60 minutes and use at 60% of volume. Some of the devices we're using nowadays, they can even alert you that the volume will be will damage your hearing. I think Samsung does that. It's quite a number of devices will give that kind of information. Now, another thing about the headphones is that I talked about having the headphones, that stereo headphones that come to the phones. I can see some of us using them, but I'm not too loud to damage their hearing. So what happens is that when you're using those small ones, is that you create too much pressure. That is what you call that's the point I was saying, that sound is energy, mechanical energy. So you create too much pressure. This pressure pressurizes the eardrum pressurizing the 3 ossicular chin, the small bone, and then the chin continues like that to the hearing organ. So yes, the earphones can affect our hearing. Now, lately you find that, especially in the morning hours, when people are rushing to work, or they are walking, they would want to have this stereo earbuds with them. They listen to their classic favorite FM station in the morning. So even if you hoot behind, that person cannot hear. So you're left wondering, how much sound is this person exposed to? And that's the cases that you're saying. The hearing impairment is much of age-related. Is coming down from 60 to about 55, because when you're young, you expose yourself to too much noise, and it is not helping you much later as you advance in the age. Yes, the headphones can cause the hearing impairment, but in the meetings, especially the people who are doing the meetings online every time, it's good to have the big headphones, the traditional one. It doesn't look so fashionable though, but it's very good. The reason is that it covers just outside of the ear, and it allows the sound pressure to leak in between the headphone and also your skin. So there's a bit of sound pressure that is let out. And also, you see, when you're having these big headphones, you also keep adjusting them. So you keep on releasing the pressure in the ear.
Ikimani says, thank you for the clarification. Then there's Caroline Joki asking, when you shower or swim and water gets inside your ear, there's that discomfort that you experience, and at times that water doesn't get out. Where does that water go? And would it cause a problem later?
The water doesn't go anywhere. So this thing is a perception. So what happens? You'll feel you're blocked, and some people will try to get the right side, get the left side, jump a bit, and some people will say there is a hot water came out from the ear. Yes, sometimes it can happen like that. But what makes you feel like they still block it? It's where the water was, or the water was in the ear canal, slightly pushed the eardrum once again, and then before it adjusts itself back to the position, you still find a bit of discomfort. But there's nothing that is left if the eardrum is sealed. For the people who've got the ear perforation, we advise them, let no water get in your ear because it will cause more damage or infection. So if you're normal, you don't have any perforation, you have this feel like water is blocking your ear. Sometimes the water comes out and you still feel like you're blocked. It is the effect of where the water was lodged that the eardrum is trying to adjust itself. So it doesn't go anywhere, it just comes out.
Okay, great. I would have asked the same question and got someone asked, and then Dr. Moses Gray says, thank you so much. I am now well informed. Aisha Maulid is wondering, what is the cause of ringing sound that sometimes one experiences?
The ringing sound, what we call the tinnitus. There's so many things that will cause this ringing sound. In fact, even nowadays, what you're asking most of our patients is that, have you had COVID? And then you find that in most cases, a bigger percentage will say, yes, I had COVID. And this is some of the things that, the disease is just 1 year, 18 months or thereabout. So it's not well understood about that. But lately we are finding people having the tinnitus or the ringing sound. But also traditionally what we find that the ringing sound is there is that if the person has got hearing impairment, it is one of the signs that somebody has got hearing impairment. 2, it can also be as a result of wax that is built up in the ear. And 3, it can also be as a result of high intake of uncooked salt. You find that people have got tendencies of having the nyama choma and to putting some, adding salt on it. That is not good. We say that the salt has, you have to cook it so that at least you can be able not to have these problems of tinnitus. Again, you also find that people have got tendencies of having high intake of caffeine. People are addicted to coffee, that you end up having the tinnitus, or what we call ringing sound. It can be as a result of being in a noisy place, where you find that maybe you were in a very loud public transport vehicle, and the noise was too much. You find that the ear tends also to bring out this ringing sound. And as I said earlier, it can also be ringing sound where you find it's a bit of tinny. It can be cricket kind of a sound. It can also be more of fun, rain sound, or ocean-like sound. So it has got different sound depending on the levels of the frequencies that is affecting. Some people may also argue that the ringing sound also moves with my heartbeat. Also, it's type of the ringing sound, and the problem need to be addressed. The consultation has to happen, case history taking, so that you can understand where this patient is coming from and understand whether they have got any other issue apart from the ringing sound. Sometimes in medical field, we say that some conditions, they are just idiopathic. You just don't know what caused this problem. And we try to treat what we call, we treat the results. Now, at this point, I'll say that there's no known treatment of tinnitus. The big complex, people are given some vitamins. We may call them the placebo, just to treat the psychological part of it. Sometimes it helps. It's a loud way of doing the medicine because it helps to treat patient psychologically. And then you find that, sometimes it elevates the problem. That way, the problem has to be taken, the case history has to be taken. You have to understand where the patient is coming from. You have to know how their lifestyle is. You have to understand whether you have high blood pressure patients, you have to understand whether they are diabetic patients. You have to understand whether they're having any other underlying cause that may be causing this tinnitus or the ringing sound.
Okay, excellent. Move on to the next. Wango Mutua Prezo is wondering, is heavy cleaning of ears encouraged? I see YouTube videos of people having compacted wax being removed. Is this okay?
It's heavy. I didn't hear. Or is heavy cleaning of ears encouraged? No. Why we clean ears, or why a specialist will clean ears, is because there's a reason to clean it. It's not just because you want to clean it. For example, we wash our hands because we know they're dirty. The ear, the clinician, the physician, or the doctor will look into the ear and see that it's impacted with the wax, it needs to be cleaned. Otherwise, if there's nothing to be cleaned, and as the slideshow that happened earlier on is that earwax is very important when it's the ear, because it helps to trap dust, it helps to trap the bacteria that may be in the air. All that it's the work of the wax. So don't interfere with it. You have to interfere with it. The person is supposed to interfere with it is the clinician. When they look at it and they find, hey, this is too much and need to be cleaned. So leave the business of cleaning ears to itself, because the skin inside the ear is like a conveyor belt, I say. So it pushes out the wax outside. If it's too much, let it be seen by somebody and clean it. Don't use the earbuds.
Okay, all right. Next, these questions are coming in quick and fast. Virginia Ndungu, how regularly should we clean our ears by specialists? Are there home remedies one can use? I think that's what you're discouraging us from.
There are no home remedies to use apart from using. Somebody said in part of our training sometimes that the biggest thing you should put in your ear is your elbow. I mean, that's typically telling you that you should not put anything inside your ear. Okay, because you can see far. It's the ear. You cannot. I mean, you cannot see what you're doing to yourself. So there's no home remedy to do that apart from cleaning using the towel, the wax that you can see, the wax that you feel, or the wax that you just when you're cleaning yourself feel by the bathing towel. There's nothing much of home remedies to that. If some people talk of having candles, which is I've seen it on YouTube also myself, and people say, oh, it works. Oh, but how do you put that on? How does that candle work? You end up burning the house in the business of cleaning your ear, because you can see where you're placing it. Okay, so and also the specialists will clean what they can see. If this works, they'll clean it. And also nowadays, because we can project your ear to the screen, so that you can also be participating in diagnosing yourself with the help of the clinician, advising you, this is the eardrum, this is the wax, there's an insect inside the ear, all that kind of thing, you'll see them. If there's a good reason for cleaning, it will be cleaned. But you just don't clean because you've seen a little bit of brown, oily thing. No, we don't. You should not be ashamed by that.
Next. Okay. Prezo says she did not know about uncooked salt. Aisha Maulid, Richard, thank you very much. Dr. Moses Gwe is back with another interesting question. In line with home remedies, I see in my people use oil from chicken. Is it recommended?
Yeah, the people use oil, chicken oil. I think they are a good student of dawa ya moto ni moto. because wax is oil. Why are you putting more oil into it? So nothing will come out. They'll go and mix and agree. If you say something else, let's say why we clean ear using just plain water. Is a reason, because water and wax will not mix. So one has to let the other pass. So using chicken oil to clean ear, doesn't. It has been used even sometimes before I joined the field of hearing healthcare. I've heard people talking about it, but it doesn't help. There's nothing much it doesn't help. Even when somebody has got hearing impairment, when you were taking history, you'll be told, ask the patient, what have you used so far? You say, tumetumia mafuta ya kuku. So you're sitting here wondering to achieve what? Because the cases are different and they have to be treated differently. So there's no therapeutic part, or there's no treatment of what, there's nothing of chicken oil we can say is therapeutic towards the ear. In cleaning ear, in healing, it doesn't, nothing. It's just one of those myths that we have grown up listening to people.
Another question from Rezo. What of homeopaths who use candles to remove the wax? I think this you have responded to in another question.
Yeah, that one addressed it. Yeah.
Yeah. From Moza, given your profile that was shared earlier, which is very impressive, what campaigns are you leading or intend to lead regarding the loud sound pollution around the urban areas from exhausts, matatus, and building sites?
Now, for us in private sector, we all we can do is just to advise the structures of the government that have been there. We have NEMA that squarely that's their work. We've talked enough and given interview enough times that this construction you're doing without these guys having protective gear, especially for the ears, it might be good for them. I would say that the geocaching sector people should be more advised into it. Much as we can be able to give information to the policymakers, is that ours will end there. We'll talk to them, we'll advise them, but nothing much in policy making.
Is it still there?
Have we lost the speaker?
He's mute. I had frozen also a little bit. Dr. Richard. Oh, he's back. Yeah.
Can you hear me?
Yes, you're
So
back.
where are we? I was answering the question of the campaigns of the noise pollution. The policymakers, we have very good structures in this country, but making the policies, implementing the policies has been an issue. But maybe we'll head up at some point into regulating these things, because in other countries, especially the Western countries, it's happening.
You're mute, Rotarian Joy. You're mute.
Sorry. The last question is from Dr. Joe Kamau. At bedtime, is there a specific sleep position that reduces the ringing noise?
No and yes. I would think of you see this noise. It is not coming out. It is your own. You perceive it internally. So even the person sitting next to you or sleeping next to you, you can hardly hear this noise. So it is so much into the inner part of the ear, and any sleeping position will not elevate it. 1, 2 is that if the noise is as a result of an experience you had, there was too much noise, there was an explosion, or you spend your day in a noisy place, and you find that you might sleep on the right, depending on the side that was exposed, it might elevate, because there's something we call temporary threshold shift. It also happens that the hearing gets interfered with. Then there's this compensatory way of the ear, when it's trying to recover, or the ringing sound is happening for quite some days or some years. Nothing of position to
The last comment is from Dr. Moses Bay again, saying, thank you, Dr. I have unlearned the use of chicken oil. So I think you can continue from this point.
Let's see where we were. Can you see my screen now?
Yes.
Okay, good. Now, dizziness is an interesting topic also. So what is dizziness? You'll find that people experience dizziness, they describe it as of the number of sensations, such as spinning, what we call vertigo, lightheadedness, or feeling faint, steadiness, or loss of balance, a feeling of floating, wooziness, or heavy-headedness. Those are the type of things that you find somebody experiencing, all telling you that they've been having this kind of feeling. Now, when is good time to see the doctor? That GFI image there might cause some dizziness to some of us. Yeah, but is there, these things is handled, by neurologists and also by hearing and balance centers. Now, when there's a recurrent, sudden, severe, or prolonged unexplained dizziness or vertigo, the vertigo is a spinning effect, remember, or when there's a sudden headache, fainting, double vision, stumbling or difficult walking, seizures, or a sudden change of hearing. So dizziness and hearing, you cannot separate them. They have to be discussed as one, because they have effects on, the hearing will have effects on the dizziness also have hearing into the hearing. So what you expect from us is that we'll ask you different questions. How to diagnose the dizziness is matters period when it happens, matters position, when you move right to the left, when you pick for something from the shelf in the kitchen, off the shelf when you try to tie your shoes. So to diagnose the hearing, I mean, the balance is that we have to look at the history, the time frame, and positioning of your, or either position is affecting the balance. So the doctor will ask you, can you describe what you felt the first time you had the episode of dizziness? It also asks, is that your dizziness continuous, or does it occur in spells or episodes? If your dizziness occurs in episodes, how long does these episodes last? How often do your dizziness episode occur? Or when do your dizziness spells seem to happen, and what triggers them? We are trying to see, is it caused by the position? Is it caused by movement? Is it caused, how long does it stay? Because it is a wide subject that has to be, you have to do differential assessment so that you can be able to rule out what exactly is causing this one. The doctor will also ask you, does your dizziness cause the room to spin or produce a sensation of motion? Most of us, when you're young, we used to, run around, and then you feel like, the world is turning upside and down. Now, imagine that kind of feeling happen without your input. So that's the kind of questions we'd want to ask. Is the room spinning? Because when you're young, you find that, things are turning upside down, and it lasts for a few minutes, and then it clears. So when you feel dizzy, we'll also ask you, do you feel like faint or lightheaded? Or does your dizziness cause you to lose your balance? Are your symptoms accompanied by the ringing or fullness in your ear? Again, tinnitus happens here, or troubled hearing. Or does your vision blur? Is your dizziness made worse by the moving your head? What medication, vitamins, or supplements are you taking? Those are the questions we'll ask you. And you're asking all these questions so that we can be able to try to get what the problem is, what is causing, what is triggering this dizziness. What I've not written there is that we ask most time is that you a heavy intake of alcoholic drinks, because it also causes balance disturbance. Now, inner ear problems that causes dizziness or vertigo, you find that your sense of balance depends on the combined input of various parts of your sensory system. And these include the eyes, the sensory nerve, the inner ear. And the vertigo is a force sensation. To describe the vertigo or the spinning effect is a force sense that your surrounding are spinning or moving. Vertigo is as a result of, your brain works to sort the confusion. Now, this is what it means. The brain is trying to sort out the confusion of all these things. We've said that the balance system depends on the eyes, sensory nerves, or inner ear. Now, if there's confusion of all those three parts, it happens that the brain is trying to sort it out, and there's the spinning effect happens. It happens so fast. It may sound like a very long, it will take 2-3 minutes, but it's something that happens so fast that you experience the vertigo, the spinning effect. Now, why we ask all those questions is because the balance disturbances can be of positional, or what you call positional vertigo. That's the BPPV, benign proximal positional vertigo, causes about 70%. Causes about 70% of the balance issues. And this is a brief but force sense that you're spinning or moving. These episodes are triggered by a rapid change of head movement. Remember the question you're asking you. Does your balance, do you feel imbalance by the movement of the head? Now, another thing that is the infection, the viral infection of vestibular nerve, something commonly called vestibular neuritis. The question we're asking is just, eliminate one condition as you're trying to rule out the other one. So vestibular neuritis is the infection of vestibular nerve. It can cause intense, cause vertigo, and also it is also combined with the hearing impairment. Now, there's also a condition that you find that the hearing impairment is involved, and the balance is involved, which you call Meniere's diseases. The disease is excessive buildup of fluid in the inner ear, and is characterized by sudden episodes of vertigo lasting as long as several hours. Now, the question about time comes in. How long does the dizziness last? Because if it lasts for several hours, you don't want also to know, is this patient having hearing impairment? Is it having also the patient having some fullness, experience of fullness? And also you may experience the fluctuations of the hearing impairment, ringing sound again comes in, or the feeling of the ear being plugged. There's also something called migraine. And of course, we all know about the migraine. And people experience migraine and also sometimes feel the spinning effect. So the thing is that you'd want to try to avoid what triggers the migraine. Before migraine happens, there's something called aura, and the sensation that you find that it is just about to happen. But some people say too much light will affect, will trigger my migraine. So you can try to avoid that one, so that this feeling of steadiness or this feeling of imbalance cannot be cannot affect you as such. Also, we have the causes of the dizziness, these neurological conditions, such as Parkinsonism, multiple sclerosis, and can also to progressive lead of loss of balance. Medication can also be side effect of some, certain medication can also cause the balance disturbances. It's also anxiety disorder, where you find that people have got certain anxiety disorders, which may cause, the lightheadedness, and also referred as, dizziness. Low iron levels also can be part of it, causing the dizziness. Low blood hypoglycemia. We find that they have got low blood sugar. They have got episodes of, some of them experience dizziness, others go to an extent of even fainting. There's also carbon monoxide poisoning, overheat, and dehydration. Now, these risk factors which may increase the risk of getting dizzy include the age. Older adults are more likely to have medical conditions that cause dizziness. You find that the chronic diseases we've talked earlier along, the diabetics, high blood pressure, or others, they may increase the risk of a patient having the balance disturbance, or what you call the sense of imbalance. Or if you have had a past episode of dizziness, some people will say this condition was treated in 2015. It recurred again in 2018. Now I'm here because of the same. Yes, it recurs, and nobody will be able to explain why the situation is, the episode is coming again. If you've ruled out all other cases and you find that this dizziness just appeared, you say that the patient never had was not sick, he never had some accident, never had his head hit, been exposed to too much sounds that can displace the balance, balance their balance. So you find that the condition just happens again and it repeats itself. Now, there's some complication of the dizziness. You find if you insist, and especially when it's positioned, that kind of a person should not drive, because we drive by looking right and left. You to have an imbalance spell. So balance is a phobia of driving, a phobia of even crossing the road by themselves. So it all depends the episodes, how long the balance is happening, how it is affecting you, because the balance disturbance that's happened by position, movement of the right to left, up and down, it is so bad that you feel like a flash and it happens, and it can even cause of an accident looking to the right and to the left, and then it happens to you. You find that it is not so safe for you to engage in this activity. The consequences of health condition that may cause dizziness goes untreated. So in diagnosis of the balance, that we'll do some diagnostic assessment. We'll start by the ear again. We look at the outer ear, middle ear, and the inner ear. I have movements, the doctor would want to see your eyes movement, by tracking an object. So most likely you sit in an examination room, and the doctor takes up the pen and try to ask you, follow this pen, takes the right to the left, up and down, change the movement, change the speed, and see how it behaves. Or what the doctor is trying to see is the involuntary movement of your eyeball, or what we call a pupil, and then something we call nystagmus, because you don't have control over those. They just happen because of the change of the position. The more diagnostic tests that has happened is video nystagmography. Now, this is a battery of tests where we try to look the involuntary eye movement. The say is called nystagmus. These movements can be slow, fast, steady, or jerky, depending on the positioning of depending on the source or what is causing the balance disturbances. So it's a number of tests, about 7 or 8 tests that if the patient is told, on the screen there will be some object, try to follow them. You'll have to put to lie to the couch flat. Well, you have some special goggles that are tracking your eye movements because they're installed with the camera. So it's a battery of tests that are done to try to see where is the origin of this balance disturbance. The treatment for dizziness is you have to look at it also separately. So history taking is very important. Diagnostic testing are very important, so you know how to approach it. For the 70%, the one I talked about, the positional imbalance, vertigo or imbalance, it's very easy to treat it because it is some maneuvers that you have to do to the patient. Depending on the side that is affected, you advise the patient on how to lie, move the head from the right to the left at certain angles, and with time, normally about 30 seconds at any interval you are doing. So the Meniere's disease, the other condition we talked about, having causing the balance disturbance. We want to see whether there's a hearing loss, because you have to amplify the hearing for this patient so that he can be able to hear well, and also use some ear surgery is done. But rehabilitative therapy is the first approach, which you find that the clinician would want to have the hearing level of a patient improved, and then you follow up how the patient is doing, maybe 2-3 months. Some patients you find that they improved, they still have a bit of ear fullness, but you can still find that there's a bit improvement, and just avoid the surgeries and that work. Because if the patient is old enough, from about 17, they still have the Meniere's disease, it's better to do the rehabilitative therapy or rather than engage them in the surgical processing. Migraine is just a medication, the lifestyle change, such as learning to identify and avoid the migraine triggers. Medication anxiety reducing triggers techniques can help in anxiety disorders. And also if his dehydration is that patient to drink plenty of fluids and help the dizziness. When the dizziness is caused by exercises and heat or dehydration, drink quite a lot of fluids. Now, that's the end of my presentation. I'm ready for some questions.
I don't see more questions on the chat, but if there, okay, there's some more. Rotary Angel. Please continue.
Okay. Dr. Moses Gwe, is there a correlation between hearing and balance?
Yes, there is. I've talked about a condition called Meniere's disease and vestibular neuritis. So this correlation, if there's balance disorder or the balance, you find that the patient has got vertigo, you'd also want to see whether the patient has got hearing impairment, because in most cases, you find that, especially in an aged patient, you find that they have got hearing impairment as if they have got the balance. But now you would want to describe or to rule out what exactly is this balance, because you find that most of them, they're having the positional vertigo, which you can treat by maneuvers. But others, you find that it is more of a combination of Meniere's disease, which has got hearing impairment. The correlation also is where they get the vestibular, the semicircular. It is having some inflammation, and also it affects the hearing impairment. So there's a great correlation. They're not too far from each other, and you find that you have to look at them, both of them, and not independently, so that you can have a conclusive diagnosis for a patient.
Merab says, thank you for shedding light on vertigo. And I don't see any other question. Anyone else with a question?
I think you can
So I
proceed.
don't think there are any more questions.
Yeah, I think you can proceed with thanking our speaker for today. I don't see any more questions. Yeah.
Richard, please accept our sincere appreciation for the outstanding presentation. On behalf of Rotary Club of Embakasi, I want to thank you for taking the time to prepare that very elaborate presentation. And we hope that soon you will agree to come back and speak to us on another date. It was a great presentation. I'm sure everyone can agree. And your certificate is on the screen. We shall be sending a hard copy to you. Thank you very much and have a good evening.
Thank you. Have a good evening. Thank you very much for having me.
Fraser, over to you.
Thank you. Thank you so much once more, Dr. Richard. And thank you, Enjoy, also for taking us through the Q&A session. We have a very important guest among us, and I really would be glad if he can say a word or two of wisdom. Dr. Joe Kamau is in the house. Dr. Joe Kamau is a district chair for governance and ethics. If you can say a word, Daktari.
Thank you, Madam President. Sorry, I joined a bit late. We had another talk from my RI membership coordinator for the entire globe. And I was one of the people who are participating in it. But I'm happy to have joined, although late, and it was a very, very insightful talk. And, you know, these are some of the things that we take for granted. And really, I'd like to say a very big thank you for the speaker for giving us such a detailed talk on that subject. Happy to join your club. We've not seen you since the installation ceremony. That very, very wonderful weekend. And I hope to again join you soon. Thank you.
Asante sana Daktari. Always a pleasure having you with us. And yes, we still remember you gracing our occasion in Moranga. And we hope we will still continue having lots of sherehe together.
Absolutely. Thank you.
Asante sana. Karibu.